in January to prepare. In fact, we operated immediately our Emergency Operations Center in order to maintain clear information from around the country and around the world to understand what was happening and to try and make sure that we were providing the public with the best information that we had to be fully transparent, but also using the data and the science to ensure that what was being communicated was entirely accurate. And as a result of that work since January, in February, just February 25th, we declared a public state of emergency here in San Francisco so that we can further prepare for the possible arrival of the coronavirus here in San Francisco. And as I said, through this process, it has been all about protecting public health and making sure that we were doing everything we can to communicate accurate information with what we know. Sometimes a lot of information gets out there. It's not entirely true, but it's important that everything that we know is communicated directly to the public so that we have accurate information every step of the way. Today, we are announcing the first 2 cases of coronavirus in our city. They've been detected here in San Francisco, and these individuals are contained. And I will let Dr. Colfax talk a little bit more about the details. And I want to be clear that we have been planning this for weeks. And so we are prepared as a city. We want people to continue to do exactly what we've asked people to do, and that is make sure that you're washing your hands and that you're doing the things that are going to help to protect yourselves in the midst of what we know could continue to be a virus that spreads. And so at this time, I'd like to ask Dr. Grant Colfax to come up and provide the details of the 2 cases that were just diagnosed.
Good morning. I'm Grant Colfax, Director of Health, and thank you, Mayor. The San Francisco Department of Health lab conducted COVID-19 tests for 2 patients and have recently found that 2 patients are infected. These results were reported to me this morning. The 2 patients are unrelated, and both are being cared for at separate hospitals in San Francisco. The patients do not have a history of travel to a location with confirmed COVID-19 cases and have no known contact with a person with a confirmed COVID-19 case. These cases are like similar cases we are seeing in the region. They are indicative of community transmission of COVID-19. The patients are in fair and serious condition and are being treated in isolation at the 2 different San Francisco hospitals. All appropriate precautions for the patient, visitors, and hospital staff are being taken. The health department has informed the patient's families this morning and is investigating the patient's history and contacts to protect the health of individuals and to help slow the spread of the virus in the community. Patient number 1 is a man in his 90s, and he is hospitalized in serious condition. The patient has underlying health conditions. He was tested by the DPH lab, and the results were given to me this morning. Patient number 2 is a woman in her 40s, and she is hospitalized in fair condition. Again, her results were provided to me this morning. To protect privacy, San Francisco will not be releasing further patient information or identifying the hospitals in which the patients are being treated. Unfortunately, these cases of COVID-19 in San Francisco residents do not come as a surprise. Given the virus has been detected in the Bay Area, California, and increasingly across the country, San Francisco has been preparing for the appearance of COVID-19 in the community for many weeks. Last week, the city declared a local emergency to boost our preparedness in anticipation of just this situation. The people who are sick are getting the best care provided by our outstanding healthcare professionals. We do not know at this point how they were exposed to the virus. which again suggests it is spreading in the community. We expected that to happen, we anticipated that, and are further investigating the circumstances of these patients' exposure. Let me be very clear. This virus does not discriminate. Stigma and discrimination is unacceptable in this time when we need to come together as a community to protect public health. All of us need to do our part. Do the basic things. Wash your hands with soap and water for 20 seconds. Cheap soap is just as good as expensive soap. If you do not have availability of a sink or soap, use hand sanitizer. Please do not come to work or go to school if you are sick. Stay at home, and if necessary, contact your healthcare provider. Ensure that when you greet people, you can do an elbow bump. Do not shake hands at this time. That is public health data that shows that that reduces the risk of transmission. I also want to stress that due to the fact that we started local testing in San Francisco on Monday at our public health lab, we are testing more people. We now have availability of test kits to test those at most risk for disease. There is no on-demand testing in San Francisco at this time, and people who have questions about their symptoms and whether they should be potentially tested should consult with their healthcare provider. Additional information from the health department is available on our website at sfdph, that's sfdph.org. Thank you.
Thank you, Dr. Colfax. And I also want to thank the members of the Board of Supervisors who are joining us here today, as well as other department heads. And I want to also reiterate that this disease does not discriminate against anyone. And the fact is, there's been a lot of xenophobia against folks who are part of our Asian community. And we know that when there is a stigma attached to a particular group of people, especially around such an important public health issue, then it's less likely that people will be willing to come forward, which means that the health outcomes we need to address this virus may not occur. So it is up to us to come together as a community and to know that at this point, based on what we know, based on the data, based on the information that we're providing, that we need to make sure that everyone feels safe, that everyone feels that they can talk to their healthcare providers, and that we're not discriminating against any particular race in our community. And with that, I want to talk a little bit about the cruise ship, which you heard the announcement yesterday that a cruise ship was scheduled to return to San Francisco that contained individuals with flu-like symptoms. We are working closely with the Coast Guard, with the Center for Disease Control, and with the state to address this issue. We know it's important that we take precautionary steps before any consideration occurs to determine where this cruise ship will land. And I want to be clear with the people of San Francisco that we're doing everything we can to work with the state and the federal partners to prepare if it does come to San Francisco, but there are certain criteria that must be met before that occurs. So at this time, I want to ask the Director of the Department of Emergency Management, Mary Ellen Carroll, to talk more specifically about what that entails.
Thank you, Mayor Breed. Good morning. This is where we currently stand regarding the Princess cruise ship that was scheduled to return to San Francisco this week. At this time, the CDC, the California State Health Department, and the Governor's Office of Emergency Services with the U.S. Coast Guard are working to determine if COVID-19 is present on the ship. There are 2,383 passengers on board the ship and 1,100 crew members. Of that, A total of 35 have shown flu-like symptoms during the course of this 15-day cruise. Many of those people have recovered and are no longer showing flu-like symptoms. Testing protocols are being put into place on the ship for those passengers and crew that have shown flu-like symptoms or may have been exposed to the virus, and that is happening today. Once we have results from the tests, the CDC and the state will determine the most appropriate location for the ship to berth, and the location needs to provide for the safety of the surrounding community as well as the passengers and crew. The CDC and the state are fully engaged in determining a location that can most appropriately address the health of those passengers that may have COVID-19 and the safety of those passengers not impacted, as well as the surrounding community. The CDC and the state are considering a number of locations, including San Francisco. However, where the ship will dock will be dependent on if the location can enact the proper CDC, state, and local protocols and has the infrastructure to protect the entire community. Our main concern is whether we can ensure those passengers that may be infected receive the care that is needed, those passengers not impacted can safely travel home, and the health and safety of our local community. This is an evolving situation that requires the federal government, the state of California, and San Francisco to ensure all the best practices and protocols are in place to accept any cruise ship that may require COVID-19 mitigation. Thank you. Sorry.
Thank you, Mary Ellen. And I just want to say that San Francisco is embarking on territory that is not unfamiliar to us. You all know that we have some of the most incredible public health experts anywhere in the world right here in our city. We've dealt with challenges over the years, whether it was the HIV crisis or SARS or H1N1, and we got through those events because we came together as a city, because we put forward best practices, and because we continue to make sure that we communicate clearly on things that the public can do in order to make sure that we protect public health. Ultimately, that is our goal, and we will continue to do everything we can to make sure that as soon as we have information available, as soon as we have accurate information available, we provide that information, and that is what we are doing here today. So I want to thank you all for coming, and at this time we are opening up for questions.
Were tests administered this morning?
Dr. Colfax?
The tests were collected yesterday. The results came in this. I'm sorry. I'll let, with regard to the patients or the cruise ship, I will let.
So were tests administered this morning, and when will they get rolled out?
The tests are being administered today, and they will be headed to the California State Lab later today.
When will we get results?
We anticipate to have results early tomorrow.
If those tests are determined to be positive, does that mean the ship will be quarantined? And if so, where would that take place? Would that take place offshore?
Christian, that's not our decision directly, but we will continue to work with the state and the port in making a decision that makes the most sense. So ultimately, we don't have an answer for exactly where the ship will be docked, whether there are people who are diagnosed or not. We don't have that information at this time, and once we know, then a decision will be made, and as soon as we know what that decision is, then we will provide that information to the public.
Can you tell people some of those protocols and procedures you're talking about? There's a lot of fear surrounding this,
Yes.
failures with other cruise ships.
Yes.
Can you detail some of them?
Yes, so we're working very closely with the CDC. They are developing those protocols. We just want to assure you that the City of San Francisco is working closely. Once those protocols are developed, the CDC with the state will make recommendations as to what the disposition of the ship, when it can berth, and where.
And for those families that were diagnosed here in San Francisco, are their families quarantined, or are they in voluntary quarantine? What is the procedure now to prevent people who are associated with those two presumed cases or confirmed cases? I'm not sure if they've been double checked
That's right. So as we are speaking, our public health team of experts is assessing the families, their risk factors, and determining exactly what procedures we need to follow per CDC guidelines to ensure that their health is protected as much as possible, as well as transmission risk is mitigated and reduced as much as possible.
So at this point, we don't know if those families, the families of the 4-year-old woman in her 40s and the man in his 90s are quarantined.
We will follow the CDC guidelines with regard to that. So we will be monitoring them for symptoms, taking a close history to ensure that to see if there are any additional public health steps that need to be made and whether testing is indicated at this time.
Has an office building on Front Street been closed in relation to either of these individuals that's been confirmed?
I am not familiar with that situation.
At what point do we close the schools in the city?
So there is conversation across the country about those type of interventions. There's no recommendation at this point to close schools regionally or by the CDC. We're monitoring the situation carefully.
And do we know if those people have taken public transportation at all in the last few days?
We do not have additional information at this time.
Can you talk about what led to those two individuals to be tested since there's no testing on demand?
Yes. So over the past few days, the CDC expanded the testing criteria to include people who had serious viral pneumonia-like symptoms with not another diagnosis of another pathogen. So in typical cases, this would be people who have pneumonia that looks like a seasonal flu pneumonia, but they test negative for that seasonal flu pneumonia. So because our clinical team was very was watching these cases very closely, and because of the change in the CDC criteria, and because we received test kits here Monday, we were able to test these people who are eligible for testing based on those expanded CDC guidelines.
It sounds like the cruise ship may not come to San Francisco. What are the other options?
Those options are being vetted now. We don't have a list of those options yet.
You're saying the city here is very well prepared. Is there concern that it could go somewhere else that isn't as prepared?
The state who is lead on this is the care and the welfare of the people on the ship is of the utmost importance, and so where it ends up has a lot to do with the resources that will be available to serve the passengers and the crew, and so that's a lot of the decision point on where it will end up.
Do any of those patients have children or families that you're watching or observing?
So again, out of respect for the privacy of the patients, we cannot provide details on that situation, but the public health team is investigating, and all proper guidelines will be followed with regard to tracking, testing, and protecting patients and their families.
What kind of steps are underway to protect the medical staff that are dealing with those patients, or
Yeah.
those patients who perhaps before they were known to have been diagnosed?
Right.
In other words, presumably they had interactions
Yes.
with medical personnel before they had.
That's right, and because these were because our medical staff was vigilant, all proper procedures were followed to protect staff, as these were people under investigation, known as PUIs. So in that situation, the proper infection control procedures were followed.
City employees like Sunset Scavengers, the public are spitting in the garbage, they're not disposing of their spit properly. What message do you send to the public to make sure that when they do spit and dispose of it, that it's wrapped up? Safety precautions.
Well, I think I would go back to the safety precautions that we talked about in terms of ensuring that you wash your hands, use hand sanitizer if that's not available, elbow bump instead of shaking hands, don't come to work if you're sick, or don't go to school if you're sick, consult with your healthcare provider, and certainly people should take general hygiene procedures at all times with regard to the saliva and other bodily fluids. Thank you.
They don't know that. And if someone's spitting in the garbage and they touch it, I mean, we don't know what's in the garbage.
Will everybody on board the cruise ship be tested, or just a certain select number of people?
The CDC will select who is be tested, but they are testing folks who were symptomatic first.
Is there concern then, once the ship does dock somewhere, not everyone is tested, that this could spread past where it ports?
Again, this refers back to the CDC protocols that are under development, and all those considerations will be taken.
Do you know if everyone who got off the ship on February 21st when it came to San Francisco
So we are planning to contact all people who got off the ship who are residents of San Francisco, and we'll get back to those people to inform them that if they should consult with their healthcare provider. We are following rapidly developing state and CDC guidelines specifically around more details on that protocol.
Is it known how many people are San Francisco residents who did get on that ship?
I don't have that number to share at this time.
What is the shift in strategy now that we do have confirmed cases here? In other words, before it was about prevention. Wondering if now that we do have presumed community spread cases, if that means that there's a shift in strategy here in San Francisco.
Well, I think that is a key point. So there's still prevention. Again, everybody should do their part with regard to these proper procedures. And we are now working on community mitigation. And really focusing on the populations at highest risk for poor outcomes from this disease based on the data. So we are working with key partners across the department, with other city departments, other partners in the city, to particularly focus on people who have chronic diseases, the elderly, people who are elderly, and other vulnerable populations.
Is there any relationship between the two patients and people who are on board the cruise ship now or who were on board the cruise ship previously?
I cannot speculate on that at this time.
Is it intentional that they're being treated at two separate hospitals?
Not at all. These were the sites that were were the hospitals that they went for treatment. There is no intentional effort on that part.
And both hospitals have isolation wards and negative pressure.
All proper procedures are being carried out at those hospitals at this time.
Major, you were some budget cuts that we did up the year. Now the nurses are going to have a rally from the city hall saying that they don't have enough staff, and they're asking if you are planning to roll back the budget cuts in light of what's happening. At least for the health department.
I'm not sure what you're talking about as it relates to budget cuts. I made a specific recommendation to all city departments to cut back their expenses in their budget, which doesn't necessarily equate to cut back to their staff. So I asked for a 3.5% reduction in their overall budgets. But let's be clear. The fact is, this coronavirus is having a significant impact on our economy as well. And so we're going to need to be prepared to deal with what will be a significant reduction to our budget in the coming year as a result of cancellation of conventions and the loss of hotel tax revenue and a number of other challenges that exist with our businesses. But at the end of the day, the most important thing that we have to focus on is protecting the public at this time, and we need to come together to focus on that. Thank you.
I don't have the exact location, but it is at sea.